This is Mr. Rajesh's leg scan from 6 months ago. 70% blockage in his main leg artery. His family doctor said, "Stop walking, you will damage your leg further." But here's what shocked me as a vascular surgeon. Following that advice almost cost Rajesh his leg. I am Dr. Sumit Kapadia, vascular surgeon, and with 20 years of treating circulation problems, I have discovered that the most common advice given to people who have circulation problems is rest when it hurts. It's not just wrong, it may be dangerous. Today I am going to show you the stop-go protocol that saved Rajesh's leg, improved his walking distance by 300%, and why 80% of people with peripheral artery disease are unknowingly making that mistake by following conventional advice. If you experience calf pain that only appears while you're walking and disappears when you rest, then this video could change your life or save someone else's. Let me paint a picture that happens in our Indian families every day. Your father walks to the market. After 100 meters, his calf starts cramping, sharp, tight pain. He stops, rests for 2 minutes, the pain disappears, and he continues walking. Sounds familiar, does it? But most people think age hai, muscles are weak, or it's just my back. But remember, sometimes this may not be just muscle weakness. It may be your leg arteries crying for help. This specific pattern, which is pain during walking, relief with rest, is called as intermittent claudication. And this is the hallmark sign of people with peripheral artery disease or PAD. And here's the shocking part that sometimes most family doctors forget to tell you. PAD affects 1 in 5 Indians over 60, and 80% of them don't even know that they have PAD because they think it's just normal aging. The truth, your leg arteries are narrowed by plaques, just like your heart arteries. When you walk, your muscles need more oxygen, but the narrowed arteries cannot deliver it, and that's why the muscles are paining. The conventional advice, rest when it hurts, don't push through the pain. The advice is not just wrong, it's making your condition worse. Let me tell you what exactly happened to Rajesh. 6 months ago, he came to my OPD. 65-year-old, retired teacher, could barely walk 50 meters without severe calf pain. His previous doctor told him, "Aram karo, walking se problem aur badhegi," thought he was protecting his legs. But when I saw his scan, I saw that within 3 months of rest, his 50% blockage had progressed to 80%. His leg muscles had weakened. His circulation had worsened. That's when I realized the conventional advice was killing his legs slowly. I told Rajesh something that surprised him. We are not going to stop walking. We are going to walk differently, and we are going to save your leg. Today, 6 months later, Rajesh walks 2 kilometers every morning. His blockage hasn't progressed. His pain has reduced by 80%, and he has avoided surgery. The secret, the stop-go protocol. And I'm going to teach it to you right now. The stop-go protocol is based on a simple medical principle. Controlled stress makes your body adapt and grow stronger. Just like weight training makes your muscles stronger by creating controlled stress, the stop-go protocol makes your circulation stronger by creating controlled oxygen demand. And here's exactly how it works. Step 1, walk at your normal, comfortable pace. Step 2, when you feel moderate calf discomfort, not severe pain, just discomfort, you may stop at that point. And step 3, rest until the discomfort completely disappears. Usually it takes 1 to 2 minutes. Step 4 is where you resume walking. Step 5, repeat this cycle for 30 to 40 minutes. The key word here is moderate. We are not pushing through severe pain. We are training your arteries to develop collateral circulation, natural bypass routes around the blockage. Also, the muscles start getting used to a little less oxygen and they also become stronger. Now let me explain the fascinating medical science behind why this works. When you walk to the point of moderate discomfort, you are creating what we call as ischemic preconditioning. Your leg muscles are sending distress signals. We need more oxygen. What does your body do? It releases growth factors that helps create new blood vessels. It opens up dormant collateral arteries, and it also improves the efficiency of your existing blood flow. Your muscles start becoming stronger and their oxygen utilization capacity also improves. And the most critical part is that the adaptation only happens when you create controlled repeated demand. If you rest completely, your body thinks, no demand, no need to improve. It's like this: if you never challenge your muscles, they become weaker. If you never challenge your circulation, it becomes limited. The step-go protocol creates just enough challenge to trigger adaptation, but not so much that you cause damage. That is why Rajesh's walking distance improved by 300% in 6 months. His body literally grew new blood vessels around his blockages, and we could avoid his surgery. If you follow this protocol, you can expect a week-to-week improvement, and within 4 weeks, you will see that your walking distance may actually double. So this is the first stage where you see the results in week number 4. In week 5 to 8 becomes a strengthening phase where you aim to increase the amount of walking time that you're taking. From 30 minutes, you can increase it to almost 45 to 50 minutes. And you will then start noticing that longer distances can be achieved before discomfort, and the number of breaks you need to take also start reducing. This means that your collateral circulation is developing well. But remember some safety rules. Never push through severe pain. Always rest until the pain completely disappears. If your pain doesn't disappear with rest, stop and consult your doctor. Start slowly. This is like a marathon, not a sprint. So you can take a screenshot of this right now and help save limbs of other patients or other people who have peripheral artery disease. Start with 20 to 30 minutes of total walking time. Walk at comfortable pace until moderate discomfort. Stop immediately, don't push through pain. Rest until the pain completely disappears. It may take 1 to 2 minutes for most people. Resume walking and repeat the cycle. Do this 5 days per week. Gradually, you may increase the total time by 5 minutes every week. And you should track your pain-free walking distance. That gives us a good idea of how the improvement is. If you do not see an improvement in 4 to 8 weeks, make sure to consult your vascular surgeon. But before you start this protocol, you need to know the warning signs that require immediate medical attention, where waiting for 4 to 8 weeks may not be advisable. In case you see any of these signs, you should see a vascular surgeon immediately. If you have pain that does not disappear with rest, or you have pain that occurs even if you're sitting or lying down, if you feel that your feet starts becoming cold, or there is color changes in your toes, it may be blue, white, or even black. If you see wounds or ulcers in your feet that don't heal, or if you have severe pain that wakes you up at night, these could be signs of something called as critical limb ischemia, which is a medical emergency. Remember, I am giving you a tool to improve your circulation. It does not replace proper medical care. If you are diabetic, you have heart disease, you're taking blood thinning medicine, do discuss this protocol with your treating doctor before starting. And this protocol is specific for people who have vascular intermittent claudication, the pain that comes only with walking and goes away with rest. If your pain does not fall into this category, then you must have a proper medical evaluation before starting this treatment. And for people who really want improvement in their circulation, we have specific courses designed, educational awareness courses, where we give a mix of advice, diet, lifestyle, and specific medication, as well as the requirement of procedures, which we explain in detail in the course. Do check out the link which we have given in the description for that. And if you want to try exercises which also help to improve your circulation, you might not want